Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut.
Yes.
All right, so we got Doc back with us.
I'm back.
He's back.
Banned last episode.
Before we get started, everybody like, subscribe, follow us on all the social platforms, YouTube. We are on all the things, Podbean, wherever you watch your podcast or listen to them, please subscribe. And then, of course, today we are brought to you by Rejuvime Medical, your premier anti-aging GLP-1 wellness clinic. We are all
Hormone
over
replacement.
We are all over Louisiana. Little dabble into Mississippi. I know how much you love the dabble word.
Dabble, you brought it up again.
Dabbling into Mississippi. And then also, we have to thank Weiler Plastic Surgery, one of the largest plastic surgery offices in Louisiana, and we are both the largest. We are both expanding all over the world, basically. So
you said earlier to meet your needs.
To meet all your plastic surgery and anti-aging needs. So absolutely thank them first and foremost for having us here. And then today we have got a repeat offender here with us, Ariel.
Hey.
She has come to sit down with us and chit chat before.
Yep.
And now she's back.
I love it.
What did we talk about last time?
She was brave enough to come back. NAD.
Oh, NAD.
Yeah. It was like right after
Oh, yeah,
postpartum.
that was awesome.
Yeah,
Still loving it.
Still loving it.
Are you
See,
still
I gotta
taking the
get-
NAD? And
I
love
got
it?
off it for like just a tad bit. I ran out and it kicked my butt. And then I think
Did
one of
it?
the other nurse practitioners, Amy, she did the same thing, and she was like,
She
yes.
could tell a big
Yeah.
difference stopping it. Wow.
Yeah.
Man, this NAD
I had somebody
thing.
telling me that yesterday. It was kind of crazy. Yeah.
What?
About
They went on a trip, and then they were tired on their trip, and then they got back, and then they were talking to somebody else, and they were realizing, well, because I didn't do my shots.
Because you
Wow.
did your shots.
my trip, and then I got back, and she was like, oh, I feel great again.
Yep.
Well, that's what we
I
were
feel like
talking
the same thing
about.
happened.
Big impact.
We were talking about trips and whatnot before, because now like we're all back from
Yes.
Summer vacations?
Summer
Yes.
vacations.
Summer
We're
trips.
all
Back to the grind.
We've all gone all over the world to see things. I know you were out for vacation for a while.
Yeah.
You were on a volcano. You were on.
Oh, yeah, so
remember you were in
Volcanic
the
Island.
volcano,
Oh, yeah.
Volcanic
So
Island.
cool.
Crazy.
I did. Okay, I have to tell y'all. So I went to Yellowstone, which is the
I've never been.
America's
I haven't
first
either. I want to go to the
national
Grand
park.
Tetons.
Okay, I just want to say this about the Grand Tetons. Josh and I, we flew into Montana, we went to Yellowstone, then we went to Grand Tetons, then we went up to Glacier. And Yellowstone, cool, but like after you see like 15 geysers, like they kind of all look the same.
Yeah.
But so we were like, pack the kids up, we're gonna go to Tetons. When we drove in to Tetons, Josh and I couldn't take picture. He was driving. We were just so mesmerized
Wow.
by them, because I think the difference when you go to the Grand Tetons is at the base of the Tetons. This is like
Keep saying the word Tetons.
Oh my God. It's like at the base of it, it's
The
a
Teton.
lake. So there's like such this stark contrast.
It
because
reflects too, right?
It
Doesn't it?
reflects
Yeah,
and
that's the word,
everything.
yeah.
But they're 13,000 feet in elevation.
Wow.
The Tetons?
And
Oh, so
the
scary.
Tetons.
trying not
I was
to
just
say
like, oh my, it was so, and then we went back. So like we get home and we're going through all of our pictures and we're looking at it and we're like, that's not what we saw.
Yeah.
I'm like,
It doesn't show its
It
true
doesn't
beauty.
show. It was,
Doesn't give it
it was
justice.
absolutely insane.
I
It
love
was
that,
insane.
though.
We saw a glacier, touched a glacier.
Really?
So
I mean,
excited.
growing up in Louisiana, you're just so used to flat,
Yes.
either green or brown,
Yep.
right? And the water is either brown or maybe green, right? And you
Still murky.
Still murky.
Yeah.
But you're so shocked about the color, the beauty, like the variation. Like
Yes.
when you go up to different parts of the country.
It
it's
was
amazing.
insane. We went and swam. It was probably around like 60 degrees. It was this lake, Lake McDonald in
The air or the water was 60 degrees.
the water.
Ooh,
So
it's cold.
because
Yeah,
we
it's frigid.
because when they have so when we were in the Grand Tetons, they have Jenny Lake.
Yes.
So
Okay,
Jenny
yeah.
Lake. So we went to Jenny Lake. The kids immediately ran in, like just like right into it. They loved it. It was freezing, and I was not getting in there, but like they ran in. They swam. The water was so clear. And then when we headed up to Glacier at Lake McDonald, they call it the Fruity Pebble Lake because all of the rocks are like blue and red
So pretty.
and yellow and stuff. And so and the water is just clear.
Crystal clear.
And
Okay,
it's
I
like
need that
60
itinerary.
degrees.
Same.
Oh my, it was insane.
Do it next year.
So I've been living through all y'all's trips. I haven't went anywhere yet. So
Yeah, but you have a brand new
You're a
baby.
little bit handicapped right now. So
we're going to Cabo in a month, though. So I am excited.
Oh,
The
that's
first time
beautiful.
out the country with just us two and without kids. So
that's amazing.
It's amazing.
Lovely.
Yeah, going to Vegas this weekend.
I was just saying, we're gonna
so fun.
Wait, my boys are going to Vegas tomorrow.
You told me that, yeah.
Y'all are going at the same time? Why are you going?
Your mother-in-law told me that, yeah.
Oh.
I'm going to the game with your kid. No,
Are you really? You could go to the Raiders game?
No, we are going to the Scorpions.
okay.
No, but your mother-in-law
What's
told
the
me. Yeah, I was shocked. I'll
Scorpions?
probably see him in the airport or
Yep.
something. Yeah.
What's that?
A very ancient rock band.
He's going to be like this.
Are you going
and
to
Elizabeth?
Stop it.
Is this like a Sphere show or is it somewhere else?
they're not quite big enough for the Sphere.
What is the Backstreet? I was about to say the Backstreet Boys are at the Sphere right now.
We did see you two at the Sphere, but no, this is at the Planet Hollywood. So
Oh.
this is like one of those
Retro.
Yeah, these guys are still cranking it out, kind
love
of in
that.
their 80s. So
Can you
Love
just
it.
envision this? Rock band, Elizabeth and Weiler going crazy in the audience. Freaking love it. I love it.
Yeah, we've had some crazy.
So
Wish I could be a
fun.
fly on the
We always
wall.
manage to meet up with some weird people, and it'll be fun.
But that's what I get. I was like, it's like restaurant recommendations, like me, love to eat here.
Yeah.
Da, da, da. I was like, I couldn't type it fast
Yeah, you
enough.
cranked out some good
I was
stuff.
like, here's some great places.
That's going to be a blast.
That'll be fun.
Oh, that'll be so fun. All right.
Okay.
So we are getting into, okay.
I'm excited.
Yeah,
I love this. Booty boost.
booty boots.
Booty, booty,
Boost
booty,
with
booty, rocking
Radiesse.
everywhere.
That's the best.
Is
The
it? I'm
best.
like, this is what I need. This is what I need. Because
No,
I
me
am like
too.
severely lacking.
I think that we are having such a craze and a boom in non-surgical augmentations.
Okay.
Obviously, we're
Agree.
crazy busy, and he's the expert surgeon. But there's our life is so hectic, and so many people are taking
They don't want the
little
downtime?
Yes.
Yes,
And
the
they like to just try things
non-surgical-
out too. I have a lot of patients like that. They just want to try it out, see how it is, and then they end up maybe wanting a BBL later. They're like, okay, maybe I want a little bit
Yes.
more, but they, this kind of gets their toes in the door.
Yeah.
So explain to us what exactly are we talking about here, guys? So let's break it down a little.
Okay, so
We're turning to
Tell
our
our
expert
audience.
we are
injectors.
Yes.
talking about your buttock area. So as we age, life, right, hormonal
Lose weight.
fluxes,
Lose weight.
Genetics,
Collagen,
like,
elastin, you're losing that.
Yep.
Yeah, so it is just another body part. Your butt loses all of those things,
Right.
and so
Can I say my favorite line? So when you when you look at a young woman, right?
this.
Even a young man, that young woman or a young man has fat, right? But the fat's in the
fat's
right place.
in the right places.
It's in their cheeks, lips, breast, and butt, right? As you age, it goes from your face to your neck, breast to your belly, butt to your thighs, right? And so, I'm not going to say who, but somebody I know grabs their thigh all the time and says, why is my butt running down my leg, right? And so fat is good. Volume, we have learned, right? Volume is really, really good. It just needs to be
In the right
appropriate
places.
place, right?
Repositioned.
And like you said, the non-surgical options, we're just adding volume, right?
Truly, yeah.
Right? And
I'm
so I
gonna
think
start
like you
sleeping upside down like a bat. If you keep saying
then your
that
face
is gonna-
gets flat, right? You can't. There's no good unless like you're levitating. There's no great position, but no. So the rear end. So I think a lot of ladies. I think and I think things change, right? But I think a lot of it got a really bad name, volume to the rear end or BBLs and because of some
because of specific celebrities,
specific
who crazy
celebrities,
overdid it.
crazy large rear ends, right? But as you age, we pay a lot in America. We for the last 40 years, we've paid a lot of attention to the chest, right? And we revolumized the chest with implants and now other things. But the rear end kind of came into effect a few years ago, right?
Okay, whenever you started practicing, were BBLs popular?
No.
No.
Okay, but let's tell
They
what
were
is
just
a,
being
what is a
developed.
BBL? So that's
So
like
a BBL is a surgical procedure where you're doing two things. You are sculpting down the waist. So you're removing fat from sort of a 360 liposuction from the waist. You're then taking that fat, you're maintaining the sterility. Everybody has a different way to process it, but and then you take that fat and you re-inject it into the rear. And so, and that fat is sustainable. So it doesn't just go away. You do lose some of it, but what happens is you take that fat, you're transplanting it back into the rear end. That patient's body grows new blood supply to that fat, and that fat is then alive. You do lose 33% of it right off the bat, but the remaining 66% is alive.
Yeah.
And you are really restoring what once was. Now, BBL's got a bad name because you can add a whole lot more. And so the majority of what, my practice is, especially for ladies that are a little bit older or postpartum or have had a baby, is to bring back what once was, right? And so fat can be a wonderful thing, but it's a surgery, like you said, Taylor, right? And so, it's a surgery with some significant downtime, but it has fabulous results. But there are other options to revolumize the rear end, right? And what we learned is that, filler started, what do you think, maybe 20 years ago, really?
Longer, especially
25.
Yeah.
But really, Botox, toxins started right as I was coming into the world
on the
of plastic
cosmetic
surgery.
realm.
On the cosmetic realm,
Yeah.
correct. It came from the traditional medical realm to the cosmetic realm. But fillers have probably been around for maybe 20 years. And we used to only think about it as, filling a specific little crack, right? And then we moved to, hey, let's revolumize the whole face. And then we were like, well, hell, we can do it in the face. Let's do it in
Where
the rear,
else?
right? And so what you guys are talking about today is using a specific type of filler to revolumize the rear end, right? And I think it works really well.
I think it's all about proportion. So a BBL is beautiful.
Yes.
And the contouring that it truly gives your body can be absolutely
Right.
beautiful. Now, some people, we meet the needs of the patients and the requests of the patient. Some people want to be overgrafted and have a
Voluptuous.
huge, large
Voluptuous rear.
Yes, and if it's safe, he's going to talk about it and he's
Right.
willing to do it.
Right.
The Radiesse is a good stepping stone, like she said, to see if you do want that augmentation.
That's the direction you want to go.
Now, we are not talking about a BBL result.
No.
So before we dive in deeper, this is giving you subtle improvements of the buttock.
Well, this is the facial filler before the facelift. You know what I mean? Like,
I say the chin filler before a chin implant.
Yeah.
there you go.
Yes.
Like,
And-
seeing,
And I think you can use
like, it's
a
the
specific
stepping stone.
Yeah.
It can be a stepping stone, but it could also be an endpoint if you don't want a whole lot.
Yeah.
So for a woman that's gone through a couple of kids, hormonal surges, and then losing weight, gaining weight, losing weight, a woman that's menopausal, that's lost some of that natural volume of fat. A lot of ladies forget about the rear end, and they have big, beautiful faces, but they have a flat rear end, right? Some ladies are born with a little bit of a flatter end. Some ladies are born with a bigger rear end. And so it can be a stepping stone. It can be a method to try it out, see if you like it. But I also think it can be an endpoint.
And
For
he'll
sure.
send us patients who don't have any fat
Right.
to graft.
Yes,
That's the
yes.
biggest
I was about
thing.
to
for
say,
those patients.
you can't have like a skinny
Correct.
little thing come in here and say, "Ooh, I want a BBL."
Yeah.
Yes.
You got to have
You have
fat.
to have
You gotta
to
have
move.
fat. Yeah.
So like the ideal patient for a BBL is somebody who's got, not super skinny, not super big, but got a little fullness in the midsection. And so we can take that fullness away and really sculpt down that waist and then use that as a positive in the rear
I could
end.
probably donate some fat. to like
Now there are, hey, that is
Every
happening.
patient in the world tells me that same thing. Now,
I could do that.
You can donate to your identical twin only. But
I don't
it has
have
been
one
done.
of those.
Yep, it has been done at LSU. We have transferred.
Oh, at
fat.
LSU?
Yeah. We did
Wow.
it for breast reconstruction, and we've done it mostly for breast reconstruction.
Wow.
And done it for some touch-ups. So yeah. But if you have identical twins, you can take fat from one twin and put it in the other.
I'll be darned.
So
Yeah.
cool.
Pretty interesting.
Unfortunately, I'm not a twin.
You don't have a twin.
Okay, so tell me, we're talking all about the butt, all about
Yeah.
contouring. What is the product that we're going to focus on today? Because there are options, but
Yes.
what are we focusing on today and what is it?
So one of probably the most popular and the one that I really only use is Radiesse. It is a biostimulatory filler, so it's not, exactly has a little different components to it. So
calcium
hydroxide.
Yeah.
I know I was going to
Yeah,
butcher it.
it's big
Calcium
words.
hydroxyapatite.
Most time you'll hear us, call it Kaha. So Kaha is a biostimulatory filler. It has like a little gel component to it, but then it also has the biostimulatory components to it. So when you inject it into the rear end or anywhere around the body, while it's also filling and adding volume to an area, it's also going to help you stimulate that collagen and elastin growth, which is, that's why it's very versatile for a lot of patients. So if they're wanting more volume, trying that out, we can do that. Or like Dr. Weiler said, if they've had postpartum like volume loss skin changes, we can use it to kind of, tighten that skin and kind of bring back volume.
Fill that area.
Yes.
In simple terms, can you explain to our audience why you guys use Radiesse as opposed to, or what the difference is simply between like using Radiesse versus an HA filler like Juvederm, right?
Yeah.
And then they both work.
Yeah, and I've used Juvederm
Right.
in like more of a specific contouring issue. So this patient had a hematoma and it caused like a concavity in the buttock. I actually used Voluma in that little concavity, which is an HA hyaluronic acid filler to fill that little spot. Now, it is not simulating collagen in that area, maybe the little, injection spots, maybe a little bit, but it is not causing that collagen production.
Okay.
I would say, I thought you were going to say Sculptra. Sculptra is another option.
Yeah, Sculptra is another option.
Sculptra is polyl-lactic acid, and that can be used as well in the buttock and anywhere on the body pretty much, because it is going to be high stimulation of the collagen and elastin.
Right.
Now, I think we go more towards Radiesse in our practice because
It adds that volume instantly too,
everybody
and they want that.
wants
It's got a little bit of both, right?
Yes.
It's probably
So-
the best of both worlds.
Correct.
Exactly. And I mean, you can mix too if you want to add Sculptra in it,
Yes.
but they're coming in because they want that volume replenished.
Right.
But you're also going to kind of give them a gift that keeps on giving because their results are going to be even better in 6 to 12 weeks
Yeah.
because of the
It's
biostimulatory
the
effects
instant
of
gratification
it. Yes.
society
Yes.
that we live in.
Yep.
Yes.
So you're getting a little bit of instant gratification, and you're getting an ongoing biostimulatory effect.
For sure. And, our patient that we're going to bring on later, she's going to talk about that. She took her pictures after and they looked really good, but then a few months later, they look even better. And it's amazing to see the change.
Radiesse. Okay, is this FDA approved for adding like the Radiesse is?
Yeah, Radiance. Yes.
Well, I was wondering is this like you know how we talk about like off-label
You
use?
talking about in the
No,
rear
this
end?
is off-label.
Yeah,
Yeah.
this is off-label.
Off-label.
So I was wondering is there anything that is
On label,
On label?
FDA
on label
approved.
for?
That's a good question. So our European partners do
Okay.
have.
That's what I was going to say.
Do
In the
have-
United States.
In the United States, they do
Yes.
not.
No, one of the things we have, it's a good and bad thing, right? The FDA protects us from wing nuts and crazy stuff.
Yeah.
But they're also very, very reluctant to allow what potentially could be a very good product.
Yeah.
So there are, South American, European products that are geared specifically towards the rear end, because one of the issues with the rear end, it's supposed to be and is a lot bigger than your face, right? So it's a lot more volume to fill.
Yeah.
So the reason why we in the U.S. we don't primarily use a filler for like a big old giant BBL is because of the cost issues associated with it. So it can get very costly. So if you see those online, maybe out in Beverly Hills, women can drop $100,000 on a single procedure, and they will use filler if they're very thin to get that full effect, right? In most patients, in an area you can agree with me, but we're using it for some volume,
Yes.
right? And it's great on ladies that need, not a ton of volume. You
Yes.
can achieve
You
that.
can, yes, you can. But
You can.
whenever it gets to that point too, I kind of send them out to a referral to Dr. Weiler or one of the surgeons because I'm like, okay, what is your option? Sometimes finances do come into it.
Right.
And I'm like, you're going to spend this much on a, biostimulatory filler, which is going to
Right.
be great. Or you can get the BBL, kind of,
Right.
what
Yeah.
kind of titrate it to the patient
Yeah.
and figure out where, like he said, he sends patients to us, we send them to
Right.
him.
Okay. I was just
Something
curious,
in the
yeah.
pipeline. I just looked up to see if it had been FDA approved yet, and it's still pending. But the Alaclay, which is going to be awesome. It comes in a 12.5 or 20 cc syringe,
Right.
and that is actually
your
going to be
volume.
There's
donor
your volume.
fat.
Right.
That is going to be FDA approved for the buttock.
That's
It
exciting.
is still pending. It has
Yeah.
not been released yet, and that's going to be
It's in the pipeline. It will be.
Yeah.
They're just being held up. So that's going to be a game changer
Yes.
too, in terms of like, I'm sure we'll be mixing that with Radiesse or
Correct.
Sculptra.
Yeah.
That will give these ladies an option to really go for a lot of volume.
Yes.
Yeah.
And that'll be a game changer. So talk to us a little bit about the process of how it works, the actual clinical visit and things like that.
So, like how the Radiesse,
Well, how do you
Or like-
inject it? You know,
Okay.
what's
Me,
the
like if
process?
I'm coming in, I'm like,
Yeah.
all right, I'm here for my procedure. Like, what do I have to do?
So, we're going to consult with you. I like to talk about your goals and kind of what you're trying to achieve. Are you coming in for just hip dips or is it skin laxity?
What's a hip
Or
dip?
Hip dip is, when you're kind of looking at the back end of a girl, it kind of dips in like this a little bit.
Never had that problem.
And they're more a little bit full at the bottom, and almost it could cause a little banana roll sometimes too.
Never had that problem.
I've had them. Unfortunately, I've had them my whole life. So, and
See, I could give you some.
and those
I
are
could be your twin.
you could. I'll donate some fat to you. I'm
All
just
right.
kidding.
No identical twins. No giving back and forth.
But I like to, I feel like it's really good for those patients who are wanting more skin laxity, just kind of filling in those hip dips. Some projection a little bit, but not anything too crazy. But you'll come in, we'll talk about that and where your goals are. And then we'll go through the process of it. It's super minimal downtime to it. I mean, I usually tell you just don't stay on the area for too long after. Just don't sit directly on it for 48 hours. But you can, go to your job, do all the things, ride in a car like normal. I say don't submerge your, the areas that I injected under, water.
Like
for long times.
showers.
Yes.
Like just take a shower.
Just take a shower and just keep the area clean. But minimal downtime, you can go back to resuming exercises in a few days. The procedure while we're doing it, very minimal. I usually numb the area with either topical numbing, or we use lidocaine that we'll inject. Very minimal. The product does have lidocaine in it too, so.
How many, so you're injecting, are we injecting like in different spots and stuff like that? Or are you fanning?
I call it the good butt and the bad butt. So you want to augment the good butt, which is the upper part of the buttock, that if that is augmented and full, it's going to indirectly help the lower butt.
kind of like a cheek.
Kind of like
kinda
a
lift
cheek.
it.
It's going to
Yeah.
just
Kinda like a
It is called a butt
redirect.
cheek.
Yeah.
It's going to redirect volume, right? So if you have fullness at the top part of the buttock, then you're going to lift that lower part. It's very rare that we're going to actually inject the banana roll because that already has too much volume and too much skin.
You're trying to pick it up.
Correct.
Yep.
So
You don't
we'll
wanna put
have
any
them
weight in it.
stand up, map out that area, draw on the patient. And we use something called a cannula. So it's just a little blunt tip. It does not hurt at all in the butt. So you just numb three little spots and then just run that cannula through there and disperse the tissue. They're laying on their stomach. They're talking to us the whole time.
Very comfortable.
Very comfortable, very easy.
And it depends on the patient too. So you can see, you said like you don't usually put some in the banana roll, but we did have a patient recently who had lipo like forever ago there, and she had a little bit of laxicity. So I did kind of put it in there, and it helped kind of smooth that out a little bit for her.
Yeah.
So depending on the
Patient-specific.
patient, yes, very
Yeah.
patient specific. And so to reach those goals, and most treatments we can do it in one treatment, but depending on how many syringes they're wanting to do, their result, sometimes it does take 2-3 sessions, but typically
What's
we can
on
do it in
average?
one.
How many syringes are you using on average?
6 to 14.
Okay.
I mean, we can do
Yeah.
as many as
If
you want.
they don't
but
want to keep coming back, you could do 16 at one visit
Okay.
and be done.
Yeah.
for sure.
It integrates very, very well. It's one downtime. It's easy.
It lasts about 1 to 2 years, and it keeps growing that collagen lasting while during that time
Over that
too.
time.
So you kind of get that aspect of it.
What do you guys think are some of the most common misconceptions or barriers for people that want this? Does that make sense? Like, I
didn't even like. I think it's not knowing that that's an option.
I think not knowing is
not
certainly
knowing
an
that it's
option.
an option.
I think not knowing. Do you guys think there's, I know sometimes when you talk about, if I bring it up to ladies, oh my goodness, I don't want that because I don't want a big old giant.
That's what I was going to
butt,
say.
right?
There's 2 aspects of it. Sometimes I have to, be real with them and be like, okay, I'm not going to give you BBL results
Right.
with your budget. And then I'm like, you're not going to look like, a celebrity crazy over here either. So you just have those real conversations. But it is a lot of people don't realize that is a treatment I can do. Most of the time it comes up during my regular consultations with doing their Botox or fillers. And then they just mention this part on them. I'm like, hey, well, we have this we can actually do. And I think that you would be beneficial.
Right.
Let's talk about it.
Yeah.
And I think the misconception is, there are certainly like, size doesn't necessarily equal beauty. Right.
Yes.
Or pretty back there. Right. And so I think there's been misconceptions that, you mentioned the word, hey, filler to the rear. And a lot of ladies are like, oh, no. Right.
Yes.
And because they think that you're going to give them this, Kim K
For sure.
size rear end. But in my opinion, I mean, the rear end, there are small, subtle things, like you said, you can fill. Little hip dips, like little indentations and rolls. And so, not to be weird, but a beautiful rear end is a full round, it looks great in clothes, right? And that can be achieved oftentimes with filler because you're just supplementing the areas, everybody has, I see a lot of rear ends, so everybody has irregularities. Everybody has a little bit of stretch marks, and everybody has some cellulite back there. But there are areas just genetically where some people lose some volume, and they have too much volume in one place and not enough in the other place. And so if you can fill the areas that need the volume, it really just gives you a much better overall appearance. And I think it's just gotten a bad name.
I agree.
We years back, the big thing was Quo, and Quo was used to inject cellulite dimples.
Oh, yeah.
Okay, so that is where I think that it kind of switched, where we stopped using Quo because it was taken off the market because it was pigmenting patients and forming pretty much permanent discoloration. Not permanent, but pretty significant discoloration. But switching your mindset that you're not basically removing the fibril septate coming, like pulling down on the skin, causing that little dimple. Now you can just go in and plump out that little dimple and it'll help lift it. And I think that kind of started the trend and more of the, popularity of this product. My biggest thing is, obviously they don't want to be overwhelmed with the size, but also that it's an investment.
Yep.
But explaining to them that it is going to help with the collagen production and the thickness of the skin and the skin striae, all of that being improved makes it.
It's like the gift that keeps on giving.
Yes.
And then when they hear that, they understand that, and then they realize it. Even though it is an investment, it's a good investment.
Yeah.
You're investing in your body just like you would your face.
Yeah.
It's a part that ages just as the face does.
Yeah.
So you just have to revolumize that. Stimulate that collagen
And I do feel that. So I'm in my mid 50s, right? That the rear end has become more and more of a focus. Like I have a young daughter, and just from a standpoint of bikini bottoms are getting smaller and smaller on the backside. Like the cheeky bikini thing is a little out of control. I mean, it's a very popular, isn't it?
It is. No, it is. And I'm just
but I feel like that's a societal focus. Like, in the 80s and 90s, it was like the high French cut. So the focus was on the abdomen and the legs. Now you're getting these micro rear end sizes.
Micro.
I'm micro
And
bikini.
you're like, I mean, on the beach, is that legal?
You can't wear that.
We're in Destin, Florida. Can you? This isn't the.
This is not. You
This isn't
can't.
the.
No.
This is Europe.
I am telling you, I know every time we go to the beach, the anxiety that just falls over Josh because we have nothing but girls, and he's just like absolutely not.
I mean,
oh gosh.
We have battles at my house
He's
over
absolutely not
over bikini sizes.
That's
you
it.
know,
Oh my gosh.
But it's hard. You got that coming. It's,
Yeah.
it's
Oh my
hard
gosh.
to.
I'm
It's hard to find a full
high-waisted,
coverage
full
rear
coverage.
end.
Right.
It is.
We're gonna bring back high-waisted full coverage for our kids when it comes back in. Tankinis are in again? Absolutely.
Yes, they
Everybody's wearing them.
That's what it's like. Every tankinis are where it's at, man. That's exactly.
But I do think, just from a society standpoint, we are more focused. It's sort of, South America's kind of always been focused on the rear end.
Yes.
America's been more of like a breast society, and we're still a breast society, but we're a lot more focused on the rear end. And I think that's where, like you said, these trends of filling and contouring have really come through.
That's because we all just envy that body shape of, when you talk about South American body shapes and stuff like that, they're gorgeous.
Yep.
They are
I like the contoured.
Yeah.
That contouring. I like that word. Just because it doesn't have to be crazy. Even contouring the face. Just
it goes with the
placing-
body.
Yeah.
It just looks proportional and just brings back balance.
And I think you can be, the other thing I think you can be a larger lady and still look amazing if you're contoured correctly, right?
Yeah,
exactly.
So you don't have to be this skinny little twig, that we grew up in the 70s and 80s. You can be a larger woman that's got curves and got some meat, but you're contoured.
Yeah.
And that looks amazing.
And
I
I've
think that's
seen
what's
all ranges of the patients. I've seen tiny little girls who barely have any fat, and then
Right.
I've also seen larger ladies who just want that smoothing,
Right.
or one lady, she just wanted, she didn't want a big result, but she wanted just kind of a little bit more definition between her back and her, butt.
Yeah.
And I think it was beautiful. And then you can smooth it out, and she just feels better in her clothes and looks better.
Yeah. We have a patient who had, her, a buttock lift. You know what I'm talking about?
Yes.
The incision
Yep.
here.
Yep, not performed by me, but yes.
Not performed by you. Yeah.
Wait, what?
So she has a large incision on the top part of her butt, like the lower back, and so it
Almost
left
like a
an
thong, like
indent,
a line?
kind of like that.
So, plastic surgery's come a long ways.
Yeah.
And there are specific indications for some patients that maybe have massive weight loss to remove some skin. I always tell patients, I don't ever lipo the rear end. The only thing I ever do to the rear end is add to the rear end because over time it's such a volume loss area. And so, there are some docs, and I don't know if they're still around, but some of us were taught back in the day to remove excess skin and try to pull up the rear end.
Yeah.
Because you know how you grab it and you pull it up.
Yeah, like a facelift for your butt.
Exactly. But and so that's
You just sounded like a yacht.
yeah.
Like a facelift for your butt.
That's an older sort of theory, and then with volumization and BBLs that started in the 2010 time, 2012, 15, we've realized that hey, that may not be the best thing because it can leave an indentation, leave a bad scar. It's more about volumizing. You can restore, and then we've got fillers that you can actually inject into the dermis, and contour and improve, stria and stretch marks and
Smooth it out
and things like
Shape.
that.
Yeah.
Shape it
For
up.
sure.
So,
Well,
yeah.
Radiesse has been life-changing for that lady
Yes.
because
in that indentation.
Because in the
in
indentation.
the indentation.
Yes.
Because it smooths
Amazing.
out.
Yeah.
Yeah.
Yeah, she loves you.
So yeah. So okay, let's talk to
Yeah, so we have
got
a
a patient.
patient.
Yes.
So we have a patient that's had this done before. We're going to kind of get her feeling on it, like what she was feeling prior to, during the procedure, and how she likes it now. So hang tight. We'll be right back, and we're going to talk to her.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52, and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters. We all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
My name is Parker, and I'm on semaglutide with Rejuvime Medical. My entire life I was an athlete. Stopped doing sports by the time I got to college. The college life just takes a hold of you, and all of a sudden I was not where I used to be. So I started on a really small dose, and within a week I lost 3 pounds. 3 months I was down 30. Kept on doing it because I wanted to see how far I could go, and then I was down 71 within probably 9 months. Choosing Rejuvime was by far the best decision I think I've ever made.
All right, welcome back. We have our patient here with us, Alexis, correct? Yes, Alexis. Alexis did my dermaplan this time. Okay, tell us a little bit about yourself.
Let's see, I'm 25. I work at Weiler. What do you mean?
What do you do at Weiler? What do you do there?
I'm a medical
Do you just hang
esthetician.
out or like?
No, I'm a medical
Okay.
esthetician, so doing treatments in and out of locations, working on Saturdays at our Blue Bonnet office, here and there.
Okay, are you from here?
No, I'm from Alexandria.
Alexandria.
It's 2 hours away.
Yeah, no, I'm familiar.
Yeah, I think a lot of people are now that the news
so you got out.
headlines. Yeah.
You're just like, I'm not going to stay here.
No.
Did you go to school here?
No, I went Alexandria.
Alexandria too. So what brought you to Baton Rouge?
My boyfriend went to LSU, so we came back. He was finishing up. COVID
It's his
really.
birthday today.
It is his birthday. Leo season.
Shout out. Happy birthday.
Shout out. Happy birthday, Thomas. But he at LSU, so I was like, I've never really spent that much time in Baton Rouge. Kind of just pass through, go to New Orleans, but never spent much time in Baton Rouge. So I was really excited. I was living in Austin at the time.
Oh,
So-
that's fun.
yeah.
Yeah, but Austin, it's changing. And I was
big,
like, I need
huh?
a really big.
Yeah.
It's weird, right? Keep Austin
Keep
weird.
Austin weird.
Keep Austin
And
weird.
Bought a
They
t-shirt
live
when I was
up
there.
to that motto,
And it is.
100%, in a good way, not a bad way. But
Did you ever see the Bat Bridge?
Yes.
No.
What? You guys are like, do you
What's the
even
bat
know
bridge?
what the bat bridge is?
No.
No, there's
I don't
like a
know what it is.
bridge or
Neither.
something that's got bats underneath that.
Oh, no.
What's
And
it
it's
called?
I don't know. Great. I was
I
like,
stayed
Yes.
far away.
but it's
Apparently,
like
yeah.
it's like apparently like at sunset or something like that. Like the bats.
all the bats
It's like,
Yeah,
Oh,
and it's
like-
certain times of the month. I mean, certain times of the year that like thousands
Yes.
of
Really?
bats live
heck
underneath
no.
this bridge, and
No.
at dusk,
Yes.
they all fly out. It's kind of creepy.
It's
but-
I've always heard
kinda
that
creepy.
bats
It's
love
kinda- but
blonde
it's
hair,
like a
so I think I'm
thing.
gonna stay away.
Yeah.
Yeah, no.
Yes. Yeah, on Congress Avenue.
And
Yes.
it's
Okay, yeah.
called the Bat Bridge.
Yeah.
Yeah.
Yeah,
Look at
no.
you.
Look, this
Learn
is
something
the
new every
type-
day.
But this is the type of useless information that I have in my brain.
You're
I'm like,
full of-
oh, this is Bat
The
Bridge.
Bat Bridge.
Okay, so now, all right, so you're in
Oh, wait,
Baton Rouge.
I have a question. Go ahead.
Yeah, no, go ahead.
What's your favorite aesthetic procedure? to do?
Oh,
Good one.
Microneedling.
Microneedling.
I love
Yeah.
microneedling.
Love it. I like that.
Again, aesthetics and injectables is kind of the Wild West. Everything's changing. There's just so many different things we can do now with microneedling, not just microneedling itself.
Yeah.
So I
very
just
versatile.
yeah, you can
Yeah,
just
I love it. No, I love that's
Yeah.
a real bedrock.
It's like
I think it's
OG.
just the results also that patients get from
Yeah.
it. Even if you're doing just plain Jane.
Yeah.
One day
Yeah.
downtime.
Yeah, it's so
Back at it
it's
the next
so-
Back at
day.
it. I mean, I really tell people, I'm like, we're in Louisiana. Tell them you were out in
Yeah.
the garden.
That's it.
No one
Yeah.
has to know. I mean,
Yeah. I
honestly,
went-
the next No. morning you
I got
wake
burned
up.
at the festival this weekend.
Yeah, there's always something going on. You were either at someone's house doing
Yep.
something, so there's always that excuse for a
Tell
good
them you
sunburn.
got freaking microneedling
Or
to help
that.
with your texture
Yeah.
Okay.
at Weiler
Yeah,
Plastic
I'm in
Surgery.
improving, I'm
Here.
improving my life.
We are not
Usually
here
they
to
say that
gatekeep.
after they're all cleared up,
Yes.
and they're like,
And like,
microneedling Weiler.
this is not a place for gatekeeping, Alexis. Know
Yeah,
that right
actually,
now.
it's not.
We're breaking that. No. Okay. All right. So obviously we're here talking about Radiesse, and you have been through it.
Yes.
Okay. So what made you? What was that thought process?
So, I'm 25.
You're in
again,
amazing shape.
amazing shape.
She
I
would
Yeah.
not
work
be a
out.
candidate for a BBL.
No,
She would
Absolutely
not.
She would not be a candidate.
very
Absolutely not.
petite, skinny,
She's very
little
petite,
thing.
skinny, no
I
fat.
would be told, go do this.
Yeah.
But really, I was working out, loving my weight, loving my figure, lost a lot of weight. Unexpectedly, don't really know what from, whether that was like
Do you remember that? How much
I
was it?
do.
And it was like all of a sudden, and we
30
were like,
pounds
yes.
in less than
Wow.
no semi-glutide, no nothing.
Diet
30
change?
pounds, no,
You-
nothing.
Hormones. You just
The
blame it
only
on
thing I
hormones.
was doing was drinking Celsius. I stopped drinking that. I'm not gaining any more weight again. I'm kind of just at like a normal,
So you
like,
stopped drinking Celsius. Were you drinking a lot of Celsius?
one a day. Just that was, you know,
And it was when she was
suggested
a
amount.
PEC at
Yes,
at
the
work.
front desk. Just put it
Yeah.
in my cup, drink it throughout the day, not really chugging it and getting wired. It really would. I ended ended up every throwing
day,
it
and
away.
this sounds
happened
to me.
I ended up throwing it away half the day.
I've been drinking Celsius for years.
Yeah.
That is not it. I think it was just,
just-
some type of.
I went to the doctor, got labs because I was like, okay, like I have family history of diabetes, things like that. So I was like, let me just get myself checked out.
Right.
And they're all like, look, you're good. I don't know what's going on. So I was just shedding all this weight. And of course,
I mean,
first,
I low key hate you. but
everybody's
okay.
like, wow, I
Like-
hate that problem. But I'm like, am I ill? Like,
Right.
what's,
Yeah.
what's
No,
going
it is.
on?
Yeah, yeah.
It's
Scary,
very, it was
like-
just scary.
Yeah,
Yeah.
and I was like,
Because
But
you're not
also-
a large lady,
I was
so 30
withering
pounds.
away.
30 pounds is a
30
that's
pounds
a
is a
significant
lot.
amount of weight on your
Yeah.
frame.
yes.
Yep.
But also now that we know that you're okay, really,
Like,
You look
really,
amazing.
really, that
Yeah.
you're just gonna tell people that I just lost 30 pounds by
And
drinking
it's
Celsius.
really, people were like, but, and I'm like, no, really,
I'm
like,
pretty
I swear.
sure
No.
you
I
have
swear.
I can tell you
semaglutide
that-
in your drink.
That doesn't happen in your 50s.
So I was
Maybe
really
in your
just
20s.
Enjoy it.
yes. Well, now we're at a good way. We can't really lose anymore. So I
So you
got-
lost the booty. The booty went.
lost booty and the boobs, and I was like, what? You know, the two really important things for a
Yeah.
woman. I feel like,
Yeah.
you know,
Like
once-
a confidence thing, yeah.
Yeah. Summer was coming around, and I was like, look, like, I'm just not happy. I had the hip dips. I could tell just even in my work scrubs, nothing. It just didn't look the same. It was just going away. I guess just at how fast it was going, that's how I noticed. Like, oh my God, I can't do this.
Right.
So I talked with Ariel, and I was like, look, these are the things that are going on. I was like, do you think that this would be the best thing? Because again, I know I'm small. Like, would this look
Yeah.
weird?
I don't want to go do surgery. I don't want the downtime, but
you're the perfect
what
candidate
can we
for
do?
it.
Yeah.
Yeah.
All right, I was like, jump on the table.
Yeah.
I got you.
Yeah.
I'm like,
So-
perfect
We did.
little
So
candidate.
So
with
what are your
tips.
thoughts, Ariel, when you see her and she comes in and
I think she's the perfect candidate. She's young. I mean, even though she doesn't have that skin laxity problem, she has lost that. She has the hip dips. So perfect because she didn't want any crazy
I wasn't
volume.
looking for I just wanted to feel like full.
Yeah,
again.
she wanted to add back. So, like you said, when you wear your little tiny bikinis, you'll have that little space filled in, and you just feel more confident. I mean, you're younger, y'all like to wear like cute
the skirts,
fitted clothes.
The dresses, so like you could see the dip, and I was like, no,
Right.
I'm not okay with it.
And I wanted to give
That's
you that
good.
confidence and make you feel better about yourself. I think you losing that fast weight, your body changed so quickly that you wanted that confidence back, and I think doing the Radiesse in your butt really helped.
And like I said, I worked out, but I just knew at the rate that it was going, I didn't want it to get worse.
Yeah.
Right.
So I was like, okay, I'll
Try to
just
stop it.
Stop it while I'm ahead. Not really get into the being depressed about, oh my gosh, I lost this. Let's get it back. How are we going to do that? Working out more, doing that. So
How
right.
many
Yeah, how many
syringes? What did
syringes?
she have
let me ask this.
done?
Did you immediately, when you guys talked, did you immediately say Radiesse, or did you think about anything else?
I kind of, we kind of talked and chatted about different options, but I thought Radiesse would be the best because you're getting that volume and the biostimulatory to it, and it's hard to beat those two components together. I feel like it's such a versatile filler for that area, so I really think that's why I chose that product for you. And then when we talked about it and her goals, we ended up doing 6 syringes, which I think was appropriate. She's tinier. I'm like, we can always add more if we want to, but she just wanted to kind of fill in that hip dip and kind of contour it, not really add too much projection. And I think that was
like
perfect.
just the roundness kind of like through the side. Like even like looking straight on now, you can see the difference.
Yeah.
And even doing it on the sides and filling in those hip dips, it made the bottom of her butt almost lift and look a little bit fuller. So you look like you almost got some filler. And some other people were asking, like, did you get filler in the back here? And I'm like, no, we only did it on the sides. But the way it lifted and contoured it was so beautiful and made it full all over.
And 6 syringes is a very small amount for a butt, but she is tiny.
Yes.
It was isolated to a hip dip, and so it
Yes.
was good and okay.
But now that it's just going to continue to
Yes.
build
Improve.
Her results
improve.
from when we immediately did it, we took some then, and then we took some probably a few weeks later, and then she just took some a few weeks ago or a couple days ago, and it looks so good.
So much
and it's
better.
probably like 6 weeks or 12 weeks after we've done it. But yeah, if she wanted more projection, we could always add in more filler, but she just wanted to fill in that little hip tip and contour it.
How was the procedure? Sorry. Go
No,
ahead,
because
what you
I
said.
mean, I really after that, I told myself, okay, knowing what type of filler it was, I have to work out. I have to do my part. It's not just like, got it done. Here we go.
Yeah.
So like now it pushes me to like do leg workouts.
Protect
more.
your investment.
Yeah. So like
Yes.
I'm taking my part as well and doing the extra things that I need to do for that.
Okay, so so how was the procedure? Like how?
Yeah, how was the day of?
How
Walk
was
us
the
through
day
it.
of? Like what?
Walked in, we did our before pictures. They marked me up, and then we did the lidocaine injection. It stung a little bit.
Lidocaine always burns.
It just
I hate
burns.
lidocaine.
If you had like a cut and you put an alcohol wipe over it, that's really what it feels like. But after that, we kind of just sat there a minute, talked. She was like, okay, like this is what we're doing. She talked me through it.
Let's get it.
I wasn't really nervous because, again, we talked about everything that we were going to do before we got there. So I was already mentally prepared for that, hydrated the night before, did all the things. It was like I was preparing for it.
Yeah.
You were
Like
laying
an
on
event. I was like, we're going to do something here. We're doing magic. And we're preparing for it.
You were laying on your belly, so she's just going through TikToks, and we're chatting throughout the whole
Going
time.
through
So it was
TikToks. Yeah,
easy,
so it was-
relaxing,
How
chill.
long did it take?
I feel like about an hour, maybe, hour and a half.
The whole process. Probably we're chatting a lot too through it, so sometimes that can make it a little longer.
Yeah.
Okay, so after the procedure, so you're done, you're good. Y'all said y'all did some like after pictures after, but like, okay, so now you're going home, and I know you said that, even though there's not a lot of downtime and everything associated with it, you do have to kind of like take a break from working out and kind of like
Yeah.
chilling out for a minute. How was that for you?
Something that I probably wish I would have prepared more for that, of just like knowing like I can't go home and sit on the couch. I have to walk around, or like probably the like 3 days after going to sleep, I'm a back sleeper.
Oh,
So
yeah.
crazy, but that was really hard because I'm always used to laying on my back. So I would, and I didn't want to lay on my hips because I'm like, I just got it done.
That's where you
just
focus.
got it done.
So you have to like.
So I was literally just laying on my stomach. Of course, that's not really ever comfortable to sleep on that for a few hours. So I knew I toss and turn.
That's weird. I know some people. I'm like look like I'm in a coffin. You know, like lay down. And like some people like can't sleep. It's just weird how people sleep. You know?
Yeah, but other than that, really adjusting to the sleeping, and then like I think I got it done on like a Friday, so I had that whole weekend, and I was like, what do I do?
Right.
So just kind of just walking around, cleaning the house a little bit, just trying to avoid not sitting down.
Okay.
But that's really it. I just.
So I have to ask.
Yeah.
When you went home and told your boyfriend, like, I'm going to get a butt injection.
He took my before pictures. But also he's very like, if it's something that is like benefiting me and I'm happy, why not? At the end of the day, he's like, if you're happy with it, fine. And he was like, let's take our before pictures.
Sweet. He's a keeper.
I got home, did the after pictures, lined it up. We were like, perfect. Like, this looks great. Did our thing. But it was great. He was, and again,
so supportive.
Very supportive. And again, not only that, with the results of me doing the injections, people were thinking big volump.
Right.
Yeah.
But it wasn't that. So when I didn't really tell people I got it done, just because when you hear she's getting injections to the rear, they think
it's got a stigma, right? I
mean, it is.
Sure.
And so I just
gonna
really
come out with
didn't.
like a Kim Kardashian booty,
right?
Like,
yeah. So I
syringes.
didn't want people to like expect that, but no, I mean, again, it's something I did for myself, not for
I love that.
anyone else or like everyone to be like, oh, look what she got done. But if people were asking like, you look good, your legs look good, I'm like, well,
I got booty injections.
I tell them I work out, but also to like, look, this helps as well. So I feel like just spreading the word because
plumping the rear makes your waist look smaller. It makes your legs look more in shape. It really balances you out. So I think it's beneficial. It's always, it's like when you do a tummy tuck on a woman, she always gets asked, did she get a breast augmentation? And if you do a breast reduction on ladies, they usually come back in a little angry. Not because of the breast, but why is my belly so big? Right? And so it's proportions, right? And so it just makes everything else look better, I think.
I want to turn the tables to you. What other things that you can do for the buttock? Give us your stance on butt implants.
So I am not opposed to butt implants. I think there are very few people in the country that do them well. And there certainly are in the wheelhouse. The issue with rear end implants is that they have a very high complication rate if you don't go to someone who knows what they're doing. And there's a handful of surgeons in the country that know what they're doing. The other problem with, there's two other problems. One, so first of all, is finding the right surgeon. Second is it's a dirtier area, right? The incision is made typically in between the cleft of the butt cheeks, right? So it's not, it's not like you take showers and all that, right? But it's also can be a dirtier area, so that's another reason. And the third thing is that rear end implants are put into the muscle, which is a little weird. Not below, not above. They're sort of intramuscular, the dissection plane. And then you spend a lot of time on your rear, right? You sit on your rear, you lay. I mean, it's like you said, it interferes. Like you're like, I'm a back sleeper. So they do have a higher rate of removal, upwards. Some statistically say 50% within the first 2 years.
What's the implant made out of?
It's silicone. It's solid, typically. So it's not like a silicone breast implant. It's not as soft. It's more of a silicone, solid sort of piece of silicone slip back there. The surgeons that do it successfully, they will do a smaller implant, like 300 cc's, and then add fat or filler on top of it.
Okay.
So a dual combo. Kind of deal.
Is there a risk of that, like moving though?
Oh,
I'm thinking since you're
absolutely.
sitting on your butt, all the things. I feel like it.
It's a difficult, like I said. So there's not a whole lot of surgeons that do them, and even less surgeons that do it well. It is an intramuscular placement, which means like your butt, just sitting here, you can squeeze your butt and it's moving and all that, right? It's a different type of implant, and then it doesn't have a higher risk for infections. So, but most guys that do them well are doing the combo of an implant with either filler on top or fat on top.
I'm shocked though. I thought you were gonna say, "Heck no, don't do it."
I mean, I don't do them because it's not something I do enough of.
Yeah.
And so it's just not part of my my spectrum of what I offer. But
and the results that you can get from a BBL
are very good.
Are amazing.
Right. But like someone like yourself who's very, very thin, right?
Yeah.
And would come in and say, hey, I really want a lot of volume back there. Well, you could do a whole lot of filler if you wanted to, or you could do the combination of an implant with some filler on top of it. And
I think I'm going to do like M-Sculpt to build up my glute muscle and fat or filler rather than an implant, right? If you were trying to build up the...
I agree. I mean, I think, look, it's the buttock implant is a very specific look.
Yeah.
That, a specific type of lady is searching for. And there's nothing wrong with it, but you have to find the right surgeon. And you need to go to there's a couple of guys around the country that do it well. And then you have to have sort of realistic results. And odds are it'll probably be removed in the future. So
I'm obviously going to Google butt implant pictures.
But you removed... I think it was
I was about to say
silicone though that kind of broke up in the butt a long time ago.
I mean, look, people they have all those illegal buttock injections you hear about. People die, and that's literally like people traveling around Home Depot caulk injected into the rear end, which is awful.
Oh, gosh.
So I have seen that. There was a guy that used to do a lot in Baton Rouge in New Orleans. I have removed breast implants from the rear end that have been put back there. And I have also removed...
That's a different look.
That's a different look. And I've also removed a more traditional buttock implant. But I think there is a market for it. I think there are surgeons that do a good ethical job at it. And I do think it's part of what people seek out. But the guys that do it well, they're not doing gigantic implants.
Yeah.
They're doing smaller implants. There's a lot less risks of that. And they're also covering it with fat and
combo.
Filler,
Yeah.
combo. But it's out there. It's out there. But it's very, very specific. People call me up. There's a few names that I recommend around the country. But not something that I do. But certainly out there.
The more you know.
The more you know.
Interesting.
The more you know.
Right.
I mean, that's just, okay.
So cool.
Perfect. All right. No more, any more butt talk?
Well, look, let's talk about
I love it.
M-Sculpt. Opinions on M-Sculpt.
yeah.
Love M-Sculpt.
Yep. So M-Sculpt is
M-Sculpt's going to be a slower.
So what M-Sculpt is?
Like how long? How long are you going to see results?
Or we can ask her.
I don't know. I don't do much M-Sculpt. No.
Okay. I'll refer to Taylor.
Okay, so M-Sculpt is a device that is used on the stomach and the buttock to basically build up the muscle. I always say it's like doing 10,000 sit-ups in 15 minutes whenever we place this device on your stomach, causing the contraction of the muscle, which causes obviously to build.
I've seen it. I've seen them place it on either the abs or the buttock area, and I've seen the buttock area being done on a patient, but it kind of vibrates. So like it really is tightening that muscle. Well, and then like releasing, and it's
like fitting in 10,000 squats.
Yeah, correct. And the patient they can feel so it's a really cool experience.
It's a good combination to do together.
What's like the result? Like how long is it taking to see results with M-Sculpt?
Okay, so you are having to do 6 consecutive treatments. Back to back to back.
How often?
Like within
a week.
2 a week.
Okay.
Very consistent in the beginning. And then obviously it takes time for the muscle to grow. So you will see some results, but then it's a little bit longer.
You got to maintain.
I would say the maintenance, then, I mean, obviously you grow the muscle, but then if you're not working out the muscle and engaging the muscle, then you're going to have atrophy again.
Right.
Yeah. So you need to be working out at home and stimulating that muscle growth.
But it's a great device.
Awesome.
It's a great device.
Let's do it.
It's for the rear end, you can build the muscle. You can do bis and tris. You can do an abdominal wall. It's just sort of
why work out when you can go lay on a table at Weiler Plastic Surgery?
It's a little bit of cheating, which
it
is
is. It's cheating, but I did it after my 4th child on my stomach because they said that it improves rectus diastasis by 11%, and I'll take 1%, right? And I truly think that it does help.
It certainly works.
That's
good to know because I'm gonna do that.
But I feel like a lot of our patients that do work out and they do M-Sculpt, it kind of just boosts that extra what they're already doing. So like say they've been working out a long time and they're like, my abs it's not getting tight.
Just boost it.
M-Sculpt.
And then I think different modalities work together. So then do the M-Sculpt and then come see us for some booty filler.
So right.
Because you're gonna enhance it.
Well, and we talked about that. The rear end is skin. And then a big fatty layer, right? And then muscle. And so you can increase the tone and tighten the skin. You can put more fat or grow that fatty area with fillers or fat, and then muscle, right? You can, if you're working out, you're building it. You don't want to, like, you want to do power exercises or M-Sculpt to build that volume back there.
Yeah.
But you do
You're
all three.
sore after.
Really?
Oh, yeah.
Oh, yeah.
Yeah, that's crazy.
Yeah.
I think
So.
like I said,
Okay, I'm motivated. I'm about to have a good butt.
I love it. Like, are we just injecting it? Like,
Who's next?
go
A little
ahead.
bit of both.
Like, just put it together. Well, thank you so much, Alexis, for coming.
Thank you for having me. Yeah.
Yes, thank you for sharing your story.
Everything about your story. Ariel, thank you so much for coming back.
course.
Like I
Thanks
said,
for
you were
having me
brave
again.
brave enough to come back for a second round and giving us your expertise. Is there anything on our going out statement? Is there anything that you would tell somebody who, or, like, what are you telling these patients?
I would love to tell my patients, don't be scared. Ask the questions. There is always usually an option. We can help you with it. Any kind of insecurities you have. And I love instilling that natural confidence in your patient, because when you feel better about your body or you feel better about things, don't do it just for anybody else. Do it for you. When you feel better, I feel like you work better. You
live better.
You live better. You have a
Feel
better
better.
light.
It's quality
I mean,
life.
you can tell she's walking around and
Yeah.
she has a bigger light about her. And you're like, what's the difference? And they might not know you have booty filler, but now they do. But they know that something's changed and you feel better. And it's because you feel better about yourself. You have that confidence. So I say, talk to your expert injectors, talk to your estheticians about your insecurities, and we will lead you the right way.
I love that. And Alexis, anything from somebody who may
Who's
be
on the
going through,
fence.
who's on the fence or is going through something like you went through?
Just do it.
Just do it.
do it.
Ask.
Love it.
Yeah, ask the questions like she said. Again, do it for yourself and just do it.
I love it. All right.
Love it.
Well, there you go. There you have it. Just do it. I mean,
Just
this
do
is
it.
why Nike's
Nike.
made
Nike
Nike's
commercial.
We need a
made
sponsor.
just do it, but it's just booty filler instead.
Yeah.
So thank y'all for joining us today. Remember to like and subscribe. We are on all of those podcast platforms, wherever you listen to your podcast. Go ahead and give us a subscribe, and always stay informed. Always consult before you cut, and we will see y'all next week.
Bye, guys.
Have a good day.